we're taking one step at a time, one day at a time, I guess is the best way to describe that, but with plans ahead. So when we take care of things in the day, we're also asking ourselves what's next. And having done that, just as an organization, we've been very future focused in my first year here, and we've really positioned the organization in such a way that we're able to handle this and potentially any other kinds of challenges that come our way very well. And that has everything to do with the people. And I'll talk a little bit about that later. But the first thing I want to talk about with the people is obviously the environment that we're operating in. All of our services are still functioning, still up and going. What has impact on those are whether or not individuals would like those services. Of course, everyone has the option to say, please don't come into my home at this time. And we also have obviously situations where for our supported employment department, where individuals who had employment, either those businesses have closed or they've changed operations to such that our job coaches aren't on site coaching with them as they're not currently working. However, we're still providing support to them in preparation coaching, in just preparing to help them come back to work when many of these directives are lifted, and we're able to do that. So all of J. Nolan services, family support, supported living, supported employment, independent living skills, all of those are active, and we are providing those services on a daily basis. That being said, that's impressive. We have an amazing team. And I like to say right now it's dynamic, dispersed, and dedicated. That is one of the best ways to describe the J. Nolan team. So team, I thank you. And I try to make sure I do that in every video I send out each week on our updates. It's all because of the work that you're doing, that J. Nolan is able to continue to do what we do in this time and provide the level of service that we have. In those times and those places that we're providing those services, obviously different needs come up, and we have tried to be very, very dynamic and resourceful in getting resources. One of the big things, lots of questions on that is, what about personal protective equipment? What about masks? What about gloves? And those are coming. Unfortunately, we are in the same boat many of the other companies and organizations trying to get that material but we have already ordered those. We ordered those before the city and county directives to do so. So our arrival date is Monday. I was hoping for this week, but we're getting an arrival date on Monday for our masks. And the gloves we have, they've just arrived. I actually have them here. So we're going to be dispersing those right away starting Monday. We have also had the beautiful privilege of having 250 masks, face masks sewn by one of our own supported individuals. And I just want to stop and take note of what an amazing, neat story that is within all of that's going on. Sherry, who and her support staff, who's part of our supported living program, is an amazing individual. And she said, well, I'm going to take this time where I am stuck here in my home. I can't do the things I would normally like to do. I'm going to take the interest that my staff and I have developed together, our hobby, our interest, and I'm going to do it in a way that contributes to community. And for me, this was an encapsulation of all that J. Nolan stands for, has stood for in our entire existence, which is we are about providing supports so that individuals can contribute to community in their unique way. And when it literally was unfindable, we could not get masks, she provided 250, she and her staff, sewing those by hand with love. And then our supported living directors and supervisors dispersed those. And even some of those went to some of our other staff and other departments as well. I'm overwhelmed with how awesome that is. And I am abundantly grateful to her and her team. But it really highlights that we all have the capacity, ability, and the desire to contribute to community in our unique way, how we were wired to do it. And this just highlights that. When our county couldn't get us materials, our regional center couldn't get us materials, Sherry got us materials. And that's awesome. Speaking of staff, and during this unique time, obviously we've had to kind of redo and reevaluate how we do things. And one of those things is hiring. We are still actively recruiting. This organization has needs. We have vacancies we need to fill. And so we're still actively doing that. and we're just doing it with more technology uses, like GoToMeeting and Zoom and things like that for interviews, electronic signing of documents. And so we do have people in the pipeline, and we are working to bring them on board as well. It'll be a unique time that they will never forget, having been onboarded, but we will at some point look back on this and thank them for their patience in coming on board. In addition to the amazing story of Sherry and King, her staff, I just wanted to stop and say to everyone, let's not forget in all of what's going on that April, right, is Autism Acceptance Month. I mean, it's out of the A and the A. It's Autism Acceptance in April. This is who we are. This is who we're about. This is who we're for. So take time this month to recognize that, to congratulate people, to be involved. We will be looking to host an awareness and acceptance kind of event, but we'll be doing it on this kind of a platform. So be on the lookout for an event like that. We've had a lot of requests. Some of the questions for today have been about, what can we do for all these folks that are isolated? What kind of online integration can we do? Can we still create community digitally? And the answer is yes. We absolutely will be doing that. As a matter of fact, we're starting to explore things like video bingo in the social arena in the digital platforms. We're also looking at creating an autism acceptance event digitally. We're also going to look to maybe create some opportunities to do just other kinds of games and get-togethers, meetups online. We're going to be pulling in and asking our self-advocate group to help us with that, and to be an integral part of that. So those things are coming for the folks that ask questions about that. Thank you. And I think probably something that's on the minds of a lot of folks is obviously the finances. How are we doing? Because so many organizations are in a lot of trouble. Depending on the the arena they're in, the industry they're in. We're by no means an exception to that. This is a very, very difficult time for our state and for our country. But I can assure you that the preparation work by the finance team at J. Nolan, the senior leadership team, we have positioned the organization to be in a very healthy place when this happened. Obviously, we didn't have a crystal ball and see something like this coming down the line. But one of the things that is a very, very important part of my role and my promise to all of you is that I am a good steward of the organization and its resources. And so therefore, I've sought to fulfill that. And as a leadership team, we've made some decisions that you've seen roll out, and you're like, yeah, why that? Why this? Different policies, different changes that you've seen kind of come to pass over the last year that has positioned us to be in this healthy place right now. Like I said, we are actually still recruiting. We are following all the directives from the state and obviously through our regional centers for the appropriate way of billing. We're able to bill for missed services that are related to COVID-19, and that has enabled us to be able to continue to pay our workforce. The last thing we want, the last thing the state wants to see happen is a decimation of the workforce that has been so dedicated. And honestly, as many of you well are aware that with the advocacy I do in Sacramento, I feel as this workforce has been underappreciated. And so I have been very, very loud about that, as my colleagues have been as well. And we got out in front of this very early on, before the stay-in places, before the things we saw coming, and made a lot of noise with our elected officials. And I give a big shout out to Senator Stern, Assemblyman Nazarian, Assemblyman Holden, great supporters, very much understand the challenges of our arena, and stepped up right away to influence. And DDS and the Department of Developmental Services and our regional centers have come alongside. Now, it's a little complex, and everybody wants to do it a little bit differently. We work with a lot of regional centers, and we continue to work individually with them to make sure that we're providing them the important documentation that they need, so that we can maintain the revenue, so that we can maintain our workforce and the high level of service they're providing. It is my intention to keep my finger on the pulse of that and keep you all apprised of any changes. But so long as we are in lockstep with them and following the directives they give us, we will remain healthy, and we will remain in a position to where when we come out of this, and there's still that sort of legacy cost model that will be present, we will be doing well, and we will be able to keep our workforce, keep all of you with the benefits that we have, and explore other opportunities for us to reward and to acknowledge this incredible workforce. I thank you. That really kind of rolls me into sort of my next thought, which is, we're looking forward. We have to deal with what is today, but looking forward, not only is there a horizon to this, and we're starting to hear that. Obviously the narrative is shifting now to phase 2. How do we come back out of this? How do we kind of sort of turn the faucet back on slowly to getting back to life as we want it and have had it before? And when we do that, that means there's a horizon on this. That means there's hope. Never lose sight of the fact that there is hope. Hope that you provide daily in your work with individuals, that you do with your teams and your support of one another. You all give me a tremendous amount of hope, because I have a tremendous confidence in our organization, and I'm able to communicate that in different arenas when I'm talking with elected officials, I'm talking with colleagues in other organizations. So what's coming is, as they begin to give us new directives on how we can broaden the circle, get out, get back to our lives, we will be communicating that directly with you, and we'll be able to provide the resources to help us do that. What we have learned from all of this is that leveraging technology, our resiliency, and our creativity, those 3 things have made us an amazing organization doing amazing work right now and in the future. You're going to see some changes. We're going to be leveraging technology from what we've learned to be able to do our jobs in the future, in ways that we hadn't thought of before. And I'm excited about that. I think it's going to be ways to save money, to also save your time and travel and wear and tear on people, as well as access. And that's a big thing that our team has been talking about, is look at what else we need to create more opportunities for access, more opportunities for integration, and more opportunities for us to collaborate and influence community. Because that's what we've been about since 1975. It's been about influencing our community to recognize what is necessary to be whole and healthy. And what that means is everybody contributes. And I think this situation has brought that up more than anything else, when we've felt disconnected from our community, how important it is to be an active participant in it. So I thank you so much for listening to all of that. I hope that addressed a lot of the questions that we had gotten ahead of time. And I'm going to turn it back over to Marina. I'm looking at my screen here just to make sure I hit all of those questions. But Marina, go ahead and let me know what's next.
Alrighty. Yeah, just a reminder to everyone, if you have a question, please send it via the chat box. You could send it to the organizers. So I'll see that and I'll be able to pose that question to Edward. So yeah, there's a question from we have a question about new staff who are joining the team. Are we requiring new staff to be tested for the coronavirus? And a follow-up to that, are we requiring existing staff to be tested for corona?
That's a great question. So are we requiring newly hired staff to be tested for COVID-19 coronavirus, and are we requiring our current staff? Well, we're following the directives of our elected officials and health officials in the different communities that we serve. And so right now, we do not have the authority to require that of anyone unless they are showing symptoms. So for staff that we're hiring, we're going to be very clear with them that we need you to self-isolate as we go through this process, and we want to have you come on board after 14 days being symptom-free. Our current staff, we will test and provide the opportunity for them to be tested for anybody who is demonstrating symptoms, and we'll refer to the health officials and their directives on that. And right now, that's what they're telling us we can do with testing, is like, if you have been exposed and that person, and they can ask for that, and sometimes they'll say yes, sometimes they'll say, well, I want to see if you have symptoms first. So it really has to do with what their resources are. All
right, sounds great. And
I guess one more thing. So I guess the heart of that question is: are we going to protect our staff and the people that we support from unrealistic or unnecessary exposure risk? And the answer is yes.
alrighty. Okay, so I'll move on to the next one here. So there's been a lot of federal government legislation going around. So the question was, does JNCS fall under any extra funding, if any, or any changes to funding when it comes to federal government's new programs and stimulus bills?
That's a great question. Does Jay Nolan, are we in the pipeline, if you will, to be a recipient of any of the federal funding? As of right now, no. The reason for that is the most recent act gave us a lot of things that, yes, some of the people that work for us are eligible for, but us as an organization, we are more than 500 employees, and right now that was the threshold for that federal assistance, which was to be 500 employees or less. So we're keeping our eye on that. Of course, I have Mike Piper, our Director of Finance, keeping his finger on the pulse of any changes as they bring new legislation forward. But as of right now, the loans and some of the other things we are not eligible for. However, our staff is eligible for the changes in unemployment, and we will work directly with any individual that chooses to want to self-isolate and not work, that we can furlough them, which means they're not being released from Jay Nolan. We don't have to worry about that. But you as a staff member can be furloughed, and then you're eligible, and they've removed that 1 week time period of waiting, and you're eligible to take advantage of that. Our staff that is on board right now, we're keeping whole with our own internal process of a COVID-19 code in payroll. So we will keep everybody whole as we move forward. For anybody who's been displaced and is willing to work and be on call, they may not get call, but they, being willing to be on call, then we keep them whole as well.
All right. Okay, so I'll just move on to the next question then. So what are your recommendations for the best ways to stay safe during this time when it comes to, for example, masks and staying home? What do you recommend to all of the people that we support?
That's a great question. What are my recommendations for staying safe, staying well? And I'm going to answer that in two ways. I'm going to talk about, obviously, physical safety, but I'm also going to talk about our emotional and mental safety and health. So first and foremost, we've sent out videos. We'll continue to do so on how to make face covering in the meantime till Monday and early next week when we get those additional materials, so that you have something when you go out, as well as all of our staff are trained for this. I know it sounds funny, it's like, wait a minute, it just showed up. We didn't know it was coming. How are we trained for this? You are. We train all of our staff in first aid and CPR, and in that training, our staff is trained in universal precautions. Those are the same, whether it's COVID-19, a regular flu, hepatitis, any of those things that can affect us physically. You're trained to be able to handle those things, following those procedures. It's funny, it's like your mom told you, there's nothing better than washing your hands. And if you just do that regularly, that's the biggest thing you can do to being safe. Now, in addition to that, obviously we're going to provide that equipment, the face masks, additional gloves, those kinds of things to augment that. And that's coming for those that don't already have it. Many of our staff do. And we will be providing that. And we'll keep trying to source it to make sure we get more. I'm working right now with our county as well as our regional centers to try to access more of that. Mentally and emotionally, I also recommend this, just like you see we're doing out here today. On a great day like this, on a beautiful day, get outside. If they don't have a backyard or a patio to do that on, you can go for a walk, maintaining that social distance that's recommended by our health professionals, and get out and walk. Get out and walk and talk with your staff, with others that are in home with you. If they aren't, that same distance, and perhaps have conversations. Do so in FaceTime or Skype, even if it's just a phone call or text. But make sure you stay connected to people you care about and they care about you. This is a great time to just check on grandma. It's a great time to talk to that friend you haven't talked to in a while and see how they're doing.
All right, we have another great question here. So the question is, what are some of your recommendations for conducting circle meetings, including quarterly meetings?
That's also a fantastic question. Obviously, that's part of the day-to-day. What's the recommendations for conducting circle meetings and quarterlies and those kinds of things? And it's this kind of a platform. Many of our supervisors have already started to access our own internal platform, which is called HD Meeting. And we make that available to the team through their supervisor. You can also do it with Skype. Skype allows multiple people, and so does FaceTime, actually. You can bring in FaceTime depending on the device that you have to host those. As a matter of fact, so are the regional centers. The regional centers are utilizing these same technologies and resources to be able to host those annuals. We've actually had one of those already that I know of. So that's my recommendation. Keep checking in that face-to-face way digitally. And utilizing that platform, whether it's a computer or a tablet or a phone in the center of the room, and you have all the other players of that circle on board that way. It's a great way to do it for now.
All right. Yeah, I'm glad you covered that question because I have another one here about technology. So with the coronavirus, a lot focus has been put on using digital devices to stay connected. Are there any plans? Does Jay Nolan have any plans to provide training to individuals we support on using these more accessible devices or staying safe on the internet? Or are there any plans to get more technology available to individuals we support?
That's a great question. Accessing technology and more training and more things available. Absolutely. That's one of the what have we learned conversations that the leadership team has been talking about. And in fact, it's one of the things that our fundraising department is looking into, seeking out grants to be able to access funds to provide more. And absolutely, I think it was this morning or it was yesterday, we were talking very much about utilizing the cyber training that we've done as an organization for our team in-house, helping augment that for our individuals that we support, because I absolutely want them to have more access to technology, more access to resources that help them to integrate into community as they so choose. But I want them to be safe. I want all of us to be safe in that, because unfortunately, for every good thing, there are folks out there that take advantage. So we will definitely be rolling out. You'll see some of those things coming in the next few months as we look at opportunities to provide training and to provide additional access. We're going to probably be doing some surveys to see what our individuals that we support have and have access to, and what their needs are as we prepare to try to go and get funding to help support that. It's very, very important to me. My staff has heard me say this many times. I'm a nerd. I love it. I'm all about technology and how to use it as a tool, and how to help make people's lives better with it, and use it. It's as a tool. It's not a representation of individuals. It's not a replacement of. It's a tool for individuals to make contact. Awesome.
Yeah, all right. So we had someone ask this. Someone pointed out that it's great to have an ASL interpreter, but it would be nice to have somebody in a separate window, maybe bigger on a screen, in order to sign. And I suppose this leads into the question of what kind of things are we doing to provide information, such as this video, that is accessible to people with hard of hearing, or perhaps translated into other languages.
Again, a great question, and I appreciate that. Yeah, we've got our interpreter in the same window as me because we're exploring how and the best ways to use this particular platform. Each one of them has some differences, and we had access to the live interpreter today, and put her in the window with me. But yes, we're going to be exploring more of that. Every one of the videos that we send out, including this one, after it's recording, it'll be an audio, but we provide captioning in those. So there's English and Spanish captioning in all of the videos. Actually, our wonderful moderator is the one who handles that, puts that together for us. So we will continue to do that, so that these videos have that English captioning for anybody who's deaf or hard of hearing, as well as Spanish, which is a great deal of the population of the team that we support, as well as the team that works for Jay Nolan. We're a very diverse and beautiful community in and of ourselves as we move and integrate into beautiful and diverse communities here in California. So we want to embrace that and create as much accessibility as possible. So those are definitely on the horizon. And again, we'll continue to explore how to do some of those things either better or differently as time goes on. You know what? I've got one question that was actually in the list that I didn't get to, and I really wanted to address this one because this is really cool because it's right on that same topic. One of our staff talked about supporting an individual whose primary language is ASL, as they are deaf, and wanted to know, hey, are there mechanisms to getting more hours available to support an individual by someone who speaks, in this case, signs, their primary language? And the answer is absolutely. We will do anything and everything that we can. We will go back to Regional Center and say, this is a critical thing that you need to provide support for. So anybody who has questions about services and augmenting or expanding, those kind of things, take that up through your supervisor, to your directors, and we will explore that and we'll come back with a solution. Absolutely.
All right. Yeah, I think we're getting to the end of our time. I don't see
one more question if we've got. Do we have any more questions? Give us one more.
See, does anybody else have any extra questions? I think we covered everything that was sent to me here.
Awesome. Thank you.
All right. Let's see. I'm gonna give you guys a minute. Yeah. Is there anything else you wanted to cover, Edward?
No, I just wanted to again kind of take this opportunity to thank everyone for your abundant patience, for your creativity, your dedication, and to those that we individuals that we provide support to their families, and to the staff. I humbly thank you for your trust. Because it's trust that will keep us together. It's trust that will get us through this. And I trust you completely and wholeheartedly. Your creativity, your dedication, and in your commitment to the mission of Jay Nolan. What goes on in our environment doesn't change our mission, but it may change how we go about delivering on that mission, but it will never change our mission. And I thank you for your commitment to that.
Great. Looks like yeah, that's about it. So, all right. If there are any questions that we didn't cover, if you think of anything, yeah, please be aware that we're going to continue to send updates a couple times a week. Edward's going to continue to record videos to staff, to families, to our supporters. So yeah, keep an eye out on your inbox for all of that. And thank you for joining us. Edward, do you have any last words? You already had such a nice...
Tremendous thanks, and my best wishes to keeping safe and healthy. Blessings to all of you. Thank you.
All right.